This is the hamstring prep program for use with hamstring injury-prone players. Hamstring injury-prone players have a previous history, anterior pelvic tilt, long hamstrings, and/or posterior dominant running form. This is done in conjunction with eccentric hamstrings, dynamic warm-up, hydration, and electrolyte balance. There are 2 programs that are done on alternating days. Each program has a pre-activity part and a post-activity part. Day 1.
Hamstring foam rolling. Doing one leg at a time, long strokes back and forth at a controlled pace, using the other leg for pressure on the side you are rolling. Rectus femoris. One leg at a time, using the other leg for balance. If you feel a tight spot, stop on it, flex and extend the knee until it loosens up. Again, controlled pace. TFL trigger point. Place a crossball on front side of hip and search for tight areas. Rest the ball in the tight areas for at least 5 breaths to allow for trigger point to release. Psoas Trigger Point. Place the ball between the lower abdominals and hip. Search for tight areas. Rest on the tight areas for 5 breaths to allow for trigger point to release. Supported leg lowering. Doing both legs. One leg supported in the door frame. Do not let the knee bend. The unsupported leg, we're keeping the leg straight, keeping the lower back against the floor, 10 reps. Half kneeling hip flexor stretch, 5 reps on each side with a 5-second hold. Front foot in line with the back knee, glute activation, pressing the hip forward. AT assisted Thomas stretch, 15 seconds on each side. This can be done either before or after the rest of the work. Athletic trainer assisted Ober stretch, 2 sets of 15 seconds on each side. Again, this can be done either before or after the rest of the work. Pelvic tilt with gluteal activation, 10 reps. On your back with knees bent and feet on the ground, draw your abs in, activate the glutes, verging up off the ground slightly. Mini band hip flexor and extension, 2 sets of 5 on each. Straight leg on the foam roll, bridge up using glutes, don't arch the back. Flex 90-90 position. Regression to the previous mini band hip flexion and extension, 2 sets of 5 on each again. 90-90 position of the knee and hip. Maintain lower back against the ground. Clam shell with mini band, 10 reps on each side. Sideline, 90-90 position, pushing top hand into the ground. Don't let the hips roll back. 10 reps again. Mountain climbers, 20 total. Do not arch the lower back. Look down at the ground the whole time. Pre-activity, day 2. Hamstring foam rolling. Hip flexor rectus femoris foam rolling. TFL trigger point. Psoas trigger point. Supported leg swings, 10 reps on each leg. Perform swings with inside leg. Do not arch the lower back. Keep the leg straight. Wall drill holds, 2 sets of 20 seconds on each side, 45-degree angle, 45-degree shin angle, foot slightly off the ground. Wall drill, load and lifts. Load down into the hip, drive the knee up, again keeping the foot up off the ground slightly in a 45-degree angle at the top. TFL crossover stretch, leg being stretches behind the balanced leg, toes forward. To stretch, push hips outward towards the side leg being stretched, reach overhead. Straight leg march, 10 reps on each leg. Keep the body upright, keep ankle dorsiflexed, keep the knee straight. High knee march, 10 reps on each leg. Keep the foot dorsiflexed, explode through the ground right underneath your body. Keep the body upright, do not arch back. Band resisted march for 10 yards. Forward lean, band around the waist, alternating legs, knees up, toes dorsiflexed. Both day 1 and 2 post activity. Kneeling hamstring stretch. Knee straight, toe up, slight bend forward of the body. World's greatest hip flexor stretch. Drop knee down to the floor, elbow to instep. Piriformis, table stretch. Load the hip, press back, increases stretch in the hamstring and piriformis.